Okay, good morning, good afternoon, or good evening, everybody, depending on where you're from. Welcome back to the team's annual conference, and we are now in our last day, day 5. I think we've gone through about 47 presentations so far over the last few days this week, and today we're now in day 5, and we are now covering a number of different sessions, and we're going to be starting with COVID-19 modeling and opportunities. And we've got 3 very interesting presentations to kick off this morning, and we'll get to those very briefly. And so we have 3 presentations from Duncan Shaw and David Powell to kick us off on operationalizing local resilience capabilities. And then we go to Guosheng and capacity building of USARS in China. And then Chaim Rafalowski from Pandemic, New Opportunities for Emerging Medical Services. So we're just about right on time. And just as a quick introduction to myself, my name is Kyle T. I am the Managing Director of Capacity Building National, and we are partnering with teams in many different ways throughout 2021. You might have seen us from our previous webinar series, which I'll talk about later this afternoon. So to kick things off this morning, I will turn it over to David Powell and Duncan Shaw from the University of Manchester. And please, if you don't mind, instead of me reading through your bios and your introductions, please just give us a really quick introduction when we get started. And it's over to you, David. Thank you.
Thanks, Kyle. Hello, everybody. Duncan, I wonder if you could just maybe start with the introductions while I get the presentation up on screen.
Absolutely. Well, thank you very much for the invitation to come and talk with you today in this conference. It's really important. We've been doing a lot of work with teams and with Kyle and over the last few months around webinars and understanding what might be the future of emergency management. And so it's really nice to come and talk to you about one of our specialist topics, which is local resilience capability. So my name is Duncan Shaw. I work at the University of Manchester, and we've been working in the UK throughout COVID and starting to think about what are the opportunities following COVID for a completely different way of thinking about local resilience, community resilience, and how we can engage with our communities in building the resilience of our societies. David.
Thank you. And I'm David Powell from University of Manchester, delighted to work with Duncan and his team. I bring a little bit of practical experience as a retired emergency manager myself within the UK. So it's an exciting relationship where we try to mix the kind of academic learning with the practical reality. So we hope you enjoy what we've learned over the last 2 years.
In the UK, certainly, we used to have a narrative around community resilience of, well, maybe it's not as necessary as other parts of resilience in the planning that we've got within our societies. The narrative was very much around, we're here to save you. It's an emergency services led. It's about resilience partnerships and coming to the aid of people who are in need. But there was a recognition that some events, some emergencies might be so big that emergency services will be overwhelmed. And so then what happens? Because the emergency services cannot come to save everybody. So then the narrative changed to, we're prepared, the emergency services are prepared. Are you as a member of the public, are you prepared and ready and able to respond should something happen? But then there was uncertainty about, well, how many of our communities are prepared? How many of them will react? How many volunteers will come to provide support? And this was very much where we were before COVID. And then during COVID, we saw that the narrative again changed. And we think that this can change further to be a more permanent narrative in terms of what can we do to support each other? So we need volunteers. Volunteers, please come and help. But communities were there at the very heart of providing for members who were self-isolating from the disease or the virus. Volunteers came in ways that we had previously not expected. Hundreds of thousands of volunteers coming, some coming through formal means, some coming and supporting very informally. But what can we do to support each other? Emergency services, resilience partnerships, working hand in hand with communities. So then we started to think about, well, what is the UK policy context for this? So a few years ago, 2019, the Community Resilience Development Framework was published by our national government. A few months ago, at the beginning of this year, a government document came out called the Integrated Review. And these two documents really shone a spotlight on a changing face of community resilience, putting much more focus on individuals and their responsibilities, on communities, businesses, organizations, and really trying to think about what might be a new approach to involving our communities in emergency planning, emergency response, and creating resilience of our communities. David.
So just looking back again at the experience of COVID, because I think it's been a fantastic learning exercise. You know, what do we learn around community resilience? Well, COVID certainly gave clarity. You know, communities became the answer to the problems. Communities knew where the vulnerabilities were, as Duncan's already mentioned to you, but they certainly created new capabilities. I mean, you know, the numbers of volunteers here in the UK alone were in the hundreds of thousands, whereas before for most events it would be maybe 100, maybe 200. And I know that's been replicated across the globe, which is fantastic. So I think we've all realized there is an unlimited capacity to be tapped into here of communities, and communities have an energy and enthusiasm and a will to get involved in helping during emergencies. That means that we need to change our mindset. So maintaining, refining, and embedding this new wonderful local narrative of we can also help by preparing communities to help themselves. You know, the ability to nurture and act now before fatigue with COVID or the politics get in the way of trying to, you know, translate this into something more permanent into the future. But also it gives us the ability to truly start looking at some of the inequalities and the fragilities that have been exposed during COVID. And we believe, VCSE, forgive us for the terminology, but the voluntary sector is what that really refers to. We believe the voluntary sector has a key role here going forward in addressing some of those inequalities. We also know that communities are not all in the same place or at the same level. So we're not saying everybody is prepared to be able to help in emergencies, but we are saying you start one by one. You start looking at those that are, you build the capacity, you build the experience, and then you try to share that out amongst communities that are maybe starting up. Disasters are owned by communities, though, is a simple fact. I think we've learned that over the centuries, frankly, not the last few years or decades. You know, communities are always the first to be there at the scene of a response, and they're probably always going to be the last ones there once all the recovery is finished as well. And it's really important to acknowledge that we are there to support them, not the other way around. But it also means we need to create a whole system cohesion now to manage the consequences of emergencies with local government and with local communities. So most people love the idea of community resilience. Community resilience is a term, I'm sure you're aware, that's been around for a long time now. You know, cherished communities supporting each other, communities directing, being involved in their own futures. But very often we found studies and also our personal experience, it just really gets boiled down to leafleting and volunteering. So what do we mean by community resilience in this new capability world? Well, we think it is about individuals, families, you know, individual people, individual groups. It's about community groups who already exist or who can form in the course of an emergency. But it's also about businesses. You know, we've realized how important local services are during the recovery phase of emergencies such as COVID, for example, keep life going, but also larger scale organizations, be they the third sector, voluntary sector, or indeed some of the large corporate bodies who've come to the fore during COVID and offered tremendous assets and knowledge and skills that local authorities and other responding organizations don't always have. Duncan.
So as David said, it's quite a difficult concept to grapple with community resilience, because it's very difficult to understand, well, how do we affect these people? How do we engage? How do we build these people into our response? And should we be looking at the emergency or should we be looking at communities? And sometimes it's not an easy answer. So what we've learned is that very many local authorities, local government in the UK, have been looking at others that have been extremely successful in community resilience. And it's been difficult for them to try to translate and transport those examples of good practice into their own areas. It's been quite difficult for them to understand, how do we do this? How do we operationalize community resilience? And so in the last year, David and I have been talking quite extensively about we can operationalize community resilience as a series of capabilities. So this is not something as vague or as ambiguous as community resilience. It's about capabilities that you can press a button on in order to be able to activate. And those capabilities being situated at the local level mean that they are local resilience capabilities. Sorry, next slide, please, David.
Yeah.
So these local resilience capabilities we think are absolutely key. And the capabilities, therefore, is what you're trying to translate between one area and another, one local government and another. We think that the difficulty that places have had in translating good practice is because the foundations are different. If I look at an urban place in the UK and a rural place in the UK, then they have different foundations, they have different communities, they have different structures, they have different, they have consistent guidance or consistent policies. But beyond that, there are lots and lots of differences. So what we think is that in order to translate good practice, we need consistent foundations. Those foundations are very important, but the foundations need to be aligned with the practices. Because if we have practices then that can be translated, they're translated on the same foundations. So some of the work that David and I have been doing is understanding what are these consistent foundations. We're identifying those good practices and then start to embed foundations in other places, and local resilience capabilities can then be formed, can then be translated between different areas. So this is about making it very tangible. It's about making a capability rather than talking about community resilience. And as I said earlier, it's about having the capability that's present and able to be activated in a very operational manner, because you know that the foundations are there, you know that the practices are there, and you know who to touch or who to get in touch with when you need to activate.
So what do we think are the core foundations around how you do operationalize a capability of a local community? Well, we think we would certainly here in the UK in a really exciting project involving all of the local resilience forums, which are the main partnerships responsible for delivering local responses and recovery to emergencies. We need to find out what the baseline is. So we've undertaken a national survey, which is proving to be very insightful. We're then going to develop foundations around some meaningful relationships. We think this is all about who do you need to reach out to, as Duncan has said, who do you need to gather into a system that can be operationalized, and who do you need to develop an understanding of their cultures, their needs, their ways of operating in order to be able to activate a capability. We think co-production is a key word going forward beyond COVID, so involving as many of the affected communities as possible, looking at local risk, you know, asking the question, well, who is most likely to be affected? Who is most likely to be able to play a role? And then actually trying to invite them to co-produce your plans to respond to that local emergency, we think is going to be incredibly important in building resilience. And then identifying those specific resources, assets, capabilities, skills, knowledge, intelligence, you know, the piece that local people, local businesses, local organizations bring to an organized response, and then build a system around that to integrate it into the formal emergency responses. And as a previous emergency manager, this was the bit that fascinates me the most. You know, how do you make sure that local emergency services, non-emergency services, are part of the formal official response, will welcome and will use and will integrate this fantastic capability and additional capacity that's offered by communities. We've also because of the academic background, it's important that we understand what success looks like. So we've been examining a way to evaluate this system to describe what successful resilience indeed looks like on paper, and then also to evaluate and test the capabilities, you know, rehearse people through exercises with local emergency responders to make sure that what we think they can deliver can actually be delivered on the day. So a really exciting, you know, 7 ground foundations to see if we can make this work. Recording the baseline has been really interesting. First of all, we've asked people in the UK, you know, what's your starting point? Where are you now? What kind of activities do you undertake? What relationships do you have with the communities that are affected by emergencies, and indeed services, people, family groups, businesses, etc., that can support in the aftermath? Identify where the resources and their experience lie. So look for those skill sets, look for the people out there who can truly help in a very practical way. And then start to understand where some important gaps and needs are, especially around vulnerabilities and inequalities, for example. You know, people who will be particularly affected by an emergency, but will need some additional help. We think that identifying that is probably one of the core steps to understanding what the capability needs to look like. And then, of course, if the baseline changes, be able to understand, well, what is it that we've done as part of this project to improve resilience, and what do we understand that we can share with everybody globally about how we've learned those lessons? Sorry,
so,
Duncan, yeah, go on.
So one of the aspects of this is understanding who is it that we need to build these relationships with. So we think that local resilience capabilities, they're facilitated by resilience partnerships, not necessarily driven by them. They think that they're designed, driven and implemented by those 4 groups that David mentioned earlier on, in terms of individuals, community groups, businesses and organizations. The voluntary sector is obviously key to this. Local partnerships, the resilience partnerships are absolutely key, but so are individuals, community groups. They provide the weight of response, and so many other things. Sorry, can you click on, please, David?
Yep.
So what we're doing in this group of people that David mentioned in an earlier slide, we have a group called the National Consortium for Societal Resilience. We'll talk about that in a little moment. But what we're doing is trying to create resources that sit around these relationships that can help those partners to understand, well, who should they be building relationships with, and what do they ask, and so on, in terms of what's on the slide here. So it's trying to create resources rather than saying, go and build relationships. It's about saying, well, how do I do that? Who do I do that with? And what is it that I need to build a relationship around? Again, this is one of those fundamental foundations that I talked about a little bit earlier in the presentation. So the third activity we think is to start to develop the strategy. Strategy will differ in local areas, but the key word here is about co-producing. So it's not about the resilience partnership. It's not about local government saying, well, this is what we're going to do on community resilience, which we think that certainly in the UK, some parts of the UK have taken that approach of, we'll develop the strategy. Well, because communities are so central, as David's described, we need the strategy to be co-produced with communities so that we can appreciate where those risks lie, vulnerabilities lie, where their preparedness is, and how communities can lever agency, their ability to self-determine. The strategy needs to reflect that. Therefore, the strategy can't be top down. It needs to be developed in a co-produced way with communities, because they are going to be absolutely central to this if it works well.
So identifying capabilities, let's have a look, see how we're breaking it down. So contributors, organizational volunteering, obviously a great voluntary sector out there in all of the countries participating today in the conference, I'm sure. But we think you can expand that towards business partnerships, as we've mentioned before. Let's have some volunteering days. Let's build those skills. Let's share them across some of the voluntary sector partners themselves. Spontaneous volunteers, something Duncan and I have been working on probably for about 10 years now, a fantastic resource. You know, these are the people who will turn up on there. They may not want to be a formal volunteer beyond the event, but on the day they really want to help, either because they have a altruistic feeling or they just want to support people who are in crisis, but people who pop up and may go away after the event, but are a tremendous resource. And of course, donations and management, etc. Coordinating it, you know, you can organize communities, of course you can, if you co-produce in advance, civic groups, the voluntary sector, other network resources. It's about the intelligence and information that they can bring and the infrastructure and the essential services that they can help, of course. And then in the aftermath, we're talking about recovery, you know, business continuity, and also making sure that households remain prepared for the next shock that may come along. Duncan.
David, I wonder if you move on to the next slide, please. I'll move through that slide. But so this slide very much mimics the previous slide. And here we're saying that what we need is for this system of local resilience to have in the 12 o'clock, it needs to have strategy that's co-produced. That strategy needs to moving around the clock. That strategy needs to have leadership. it needs to understand the risks, vulnerability, preparedness. It needs to be underpinned by good governance, by plans. And I won't continue going around this, but there is a system here of how to develop this local resilience capability. What we think is that local authorities, local government, can start to gauge how well are they performing in terms of their strategy. We have a series of questions that sit underneath this, and those questions effectively take a resilience partnership through how well developed is this capability in their area, where might be the gaps, where might be their particular strengths that they can share with others. But it's all about how do we understand the strategy, how can we make sure we've got the information, the management systems to be able to deliver this. Is there coordination there so that those capabilities that David just mentioned, that they are coordinated when an emergency hits, and that those systems are able to respond and able to successfully and support communities, businesses, and so on. Next slide, please, David. There's also an equivalent radar chart of the capabilities themselves, those capabilities that David went through, to say, well, how confident are we for each organizational volunteering at 12 o'clock? How confident are we that we can operationalize that? How confident are we that we're able to press a button on a spontaneous volunteer capability, a donations management capability? And so to what extent do we know that these capabilities exist because they've been exercised and they have proven to be able to respond during an emergency?
So a lot of people still in this day and age, I think, ask, well, what is community resilience and what is this new term that people are increasingly using, whole of society resilience? We've worked together with a consortium to come up with our own understanding, because certainly there isn't a well-defined understanding of this term, either nationally here in the UK or indeed globally. So we think it's about a capability created by local systems and relationships to help people and places adapt and advance. Now, okay, it's a lot of word. What we've then done is try to explain a little bit more detail what are all of those issues. Just bear with me 2 seconds, please, everybody. Duncan, sorry, you might want to just pick up. I've got some background.
So, each of these words, as David said, have been, expressed in terms of these 4 notes. But what the definition really tries to do is understand that this is about a capability, and the capability doesn't exist just out there. It needs to be designed, it needs to be nurtured. And so it's a system, and those relationships are absolutely key. David, are you able to move on in the slide?
Yes. Yeah.
So part of that capability, is a way of designing and developing that capability. David and I have been working very closely to develop a national consortium for societal resilience. Next slide, please, David. This is a consortium across most of the UK. So the resilience partnerships that you can see in purple here are all part of this consortium. They have signed up to working together to understand whole of society resilience. They have suffered from, some of them have suffered from a bit of uncertainty as to how to move forward in this issue. And essentially they want to come together to work together to make sure that they can learn lessons across different areas, and that those lessons can help them to do an even better job on developing capability, on involving communities, and on their strategy for whole of society resilience. David, are you able to?
Yeah, thank you. So I won't go through the slide. It just gives you a good view of the buy-in from a wonderful selection across both local and national government, but also the voluntary sector, business, and of course academic sectors as well. So it's a truly exciting consortium through which we hope to develop this system called whole society resilience.
There is much more information about the consortium. The vision is on the website. We have LinkedIn spaces and so on. These are all issues that we're talking about through the Manchester briefing. The link to the Manchester briefing is there. The briefing goes out to 50, 60,000 people through Teams, through UN systems and platforms. But essentially what we've got is that we're trying to develop this capability. We're trying to work with local governments to do that. And so David and I, as David said, are very excited about what the future might hold.
Thank you for the presentation, very insightful. Let's see if there's any questions from the audience. And we have, I think, just a couple of minutes here to see if there's any questions. I do have one question when we're waiting for some people to add anything to the chat or the Q&A, which is, it's interesting in terms of resilience, and we're looking at, you know, local communities, and of course all disasters are local, and I think you've clearly articulated that and the need to focus on communities. What is the impact? Is there any sort of exploration or look into sort of networks of local communities and sort of a network effect? Because there was, I think, in part of that, there was as you correctly identified, a conversation about resources and resource allocation and deliveries and things like that. But what if certain, communities are more prepared than others, or communities have different features than others? Is there a network effect that could be captured and built upon?
Yeah, I think we said, look, people I think are a little bit overwhelmed sometimes, Kyle, about the scale of, well, where do you start? Well, the answer is where you've hinted. You look to the groups that do this well, you try to understand exactly why they do it well, what the difference is, and then you start to share that with both local networks and national work. In our case, through the consortium, that's exactly where we started. So one of the colleagues at the university has been doing some case studies amongst, I think it's about 10, 15 community groups, who all of whom can claim to have and strongly claim to have some success, Carl. Once we've collated that, our intention then is to build networks and a kind of framework for understanding and sharing. But our message, to be very clear to everyone, is, look, start small. Start with those that you can access, and then use the skills that you develop in that relationship building to talk to the next group, and indeed start to engage community groups to talk to each other, because I think that's where the strength is.
Okay, great, thank you. So just a couple of quick questions. Are there examples of baseline data compiling to identify multi-hazard risks, risk reduction options, and design resilience pathways in the UK among stakeholder groups?
So was the question, is there? Because I read it as a very positive statement, Kyle, that's how it should be done. And you'd expect me to agree with that. We think that risk is the start. I mean, this is all about living with risk, let's be true. It's not living with COVID anymore. It's about living with all risks that we're going to face. So understanding the local risk profile is, of course, the right place to start, because, excuse me, that takes you on to understanding where your vulnerabilities are, where your locations are that may suffer the most. And it allows you to design this capability to be acutely prepared to actually meet that specific risk. And I do like the point that, of course, you should also work during resilience to try to mitigate or indeed prevent the emergency happening in the first place. But there's also then looking at the kind of unknown elements that come along and give you surprise that leads to emergencies. So I agree with the statement. I don't think I can have a lot to add other than absolutely, we think this is a key start point, actually. Identifying risk, understanding what's needed, and then finding the people out there in communities that can help you resolve those problems over a longer period.
Okay, and just one more question. The UK is a small geographical area with a low natural hazards risk. Is the huge number of LRFs a challenge to the viable and joined up effort to deliver societal resilience in the UK?
I don't think it necessarily has to be. I'm going to take your point about the low frequency. The issue we have here is that we're not as resilient as those countries who have a higher frequency of large-scale events, Carl. That actually probably makes us less well prepared if you think about it. We do have low probability but very high consequence events such as East Coast flooding, for example. And pandemic, of course, as we found out along with everybody around the world. There is a review of the LRF structure undergoing. I think it will strengthen their role, not weaken it. Whether it will change the geographical footprint of LRFs is an interesting thing. But our start point is resilience is all about local delivery, Carl. So I think actually it has to be about those resilience forums being placed in communities who will be affected by emergencies as being the real start point here. You can't do this nationally. Resilience can't be owned by people who are sat away from the scene of an incident. It has to be done by local knowledge, local resources. Duncan, do you want to add to that one?
Yeah, indeed. And even with 38 LRFs in England, Some might argue that, as David said, that this is even too many or too large an area, and that each region has to try and cover. So those regions are very, very different. That means that, as David said, the community is absolutely key. So it's not even about those 38 areas. It's much more than that. It's going down into neighborhoods. It's going down into these very hyper-local areas. So some might argue that it's not that there's a huge number of LRS, but actually we need to work at an even greater level of refinement down into the community level and these hyper street neighborhood level activities.
A great example, Kyle, probably comes from the Grenfell Tower fire incident, of a very local incident with some national responses, people coming from outside trying to help affected people, and the learning from that. I don't want to go into it here, it's not appropriate, but I think the learning from that shows us a local response with local knowledge and understanding of culture and needs is essential to get this right.
Okay, great. All right. Thank you, David. Duncan, thank you very much for the presentation. What's the best way to follow the work that you're doing? Now, on to our next presentation. So the next presentation is going to be on capacity building of USAR in China with Guosheng. And over to you, Guosheng. Thank you very much. And hopefully, well, if you wouldn't mind just giving us a quick introduction, that would be great. Over to you.
The topic of my presentation is the capacity building of USARS in China. So I'm the professor of National Earthquake Response Support Service of the Ministry of Emergency Management of China. And today I will show you three parts. The one is the development of the international USAR system and based on the NERSS. And the second is China USAR capacity building and future response and the future development of ERNAP and planning in the developing country. So the first part is, we know under the NERSS, there's three levels classification. The first one is international classified heavy, medium, light USAR team. And the second one is national USAR team. It's also classified into the heavy, medium, and light. And the third one is the first responders or community level emergency response. So just the last presentations is about here. So and today I will introduce the national USAR teams, how to develop in China. So and here's the standard at all levels for quality response from the NERSS. So now we are focused on the national USAR team. So we have depends on the NERSS is for the international search and rescue guideline, but then here we code the national accreditation process. So as especially for the national USAR team. So and it depends on the NERSS, we have the coordination framework. So and UN OCHA with your OSAC and ANDAC member, ANDAC team, and RDC and OSAC, and also here many USAR teams how to coordinate if the big disaster occurred. And then since about 10 years, there's a special models. We call it multi-sub and decentralized OSAC for USARS. So and in many since 2012, there are many big disaster issues occurred in the world. So and UN OCHA use these models to coordinate during the big disasters. So we can find the national level, provincial and regional and USARS operation cell. So and there's different levels with the decentralized OSAC for USAR teams for the coordination. So and then the second part, I want to talk about China's USAR capacity buildings and the future response. So here we focus the national USAR teams, and we know the IEC certifications as held by the NERSS Secretariat of UN OCHA, and also in China part in 2016, we have a working guideline for IEC in domestic of China, and have been issued to provincial earthquake administration. We call the CISA guideline. So and now, about 4 years, we in domestic of China, we have a capacity standard of USARS classification in China part. So and in 2016 and 17, and we have the national accreditation process we call the NEP by the OCHA Infra Secretariat, and we are a pilot project in China. So and from 2016, we developed this certification in domestic of China. So and here we CISA, we call the China International Search and Rescue Team, have passed the IEC the first time in 2009, and also we have a RER in 2014, and in 2019, China International Search and Rescue Team have 3 times to pass the IEC and IR, and also in 2019, another international USARS team we call the China Search and Rescue Team also passed the IEC. So since 2019, in domestic of China, we have 2 international search and rescue teams. So and during the past 20 years, we have about more than 20 missions in domestic of China and also around of the world. So that's we get the info, we get the experience and how to make the capacity building depends on the international search and rescue guideline, and also we depends on the features of the natural disaster and also the man-made disaster in China. So and we as a pilot project, we use the IEC as a domestic of guideline into China part. So in China, we have a classification of disasters in China. We divided into 4 parts: natural disaster and incident disaster, and security and safety, and public health. So and also here, you can see here in this row, we list 7 kinds of natural disaster, and also the incident disaster, and then here, and public health. And now we are focused on the natural disaster because that will cause a lot of the huge catastrophe, and many buildings will be collapsed caused by the earthquake. So and here is the natural disaster risk map of China. So here is the historical earthquake disaster in China, and here shows in the past 5,000 years, many earthquake or catastrophe occurred in the whole of China. And here is the geological disaster in China, and also here is the flooding disaster in China, and here the meteorological disaster, and here is the comprehensive disaster map of China. So in here we know the many catastrophes in the history occurred in the east part and the middle part of China. And since this century, we have more than 10 times big earthquake occurred. So surrounding the Tibet, the surrounding the Tibet. So the biggest one, the Wenchuan earthquake here, and the biggest one, Wenchuan earthquake here, and here's Yushu earthquake, and also others. So and caused a lot of the disasters, and So that's why we push the AR lab certification in China, because if we will very quickly and efficiently to make our life search and rescue missions, so we must have international. We not only have the international USAR team, we must have the national level or the community level emergency response. So the NAP certification in China since 2016, we have the pilot project. So here, and we give a certification guideline for how to give a simulating or scenario earthquake, and then the USAR team is heavy or medium or light, how to make the certification. So here is we have normally we have the emergency response, on-time decision, preparedness, mobilization, operation, and demobilization. And also we have 5 parts: the management, search, rescue, medical care, and logistical support. So in the heavy and medium USAR team, and normally we have 5 to 8 certain rescue scenario, debris objective to check the capacity in 2 different sites for heavy USAR team. For one USAR team, for one media USAR team, as only one site. So, and also we have the capability to establish and operate RDC and OSAC under the Lima Commanding and Controlling Center of China. So, and in China part, we as about 30 years, we have a special commanding and control center from the state council level to provincial and regional level and county level. So, and we establish this kinds of system. So this emergency response system combined with the USAR system, and then we have got the ER lab certification guideline in China. So, and here is in 2016, the first heavy USAR team of China was established. Here, just we have a group to declare this heavy USAR team passed the domestic checklist of certification. So we call it the national accreditation process of USARS. And also we about 20 years, we established standard operation procedures for how to respond for the international scale if the bigger earthquake occurred. So we have 3 levels to respond. And then if the big earthquake occurred in China, we have 4 levels to respond. So national level, provincial level, and national level here, and provincial, regional, and county level. And so since the 2018, the Ministry of Emergency Management of China was founded. So, and now we have a coordination and a supervision mechanism in China part. So, and we have a response, operation, relocation, recovery, coordination. So, and if the catastrophe occurred, we have the first level national response. That's the national level response. And if there's here, and we have the death toll as well over 300. So the caused by the building collapse. And the second level is a regional or provincial level. So as the death toll is between 50 to 299. And third level as a city or regional level, regional response. and level 4 is county response level. So so here is the coordination and the supervision mechanism in China, and also we have normally the state councils of China will respond to level 1 emergency issues. So the Ministry of Emergency will operate. So now we have the operation office of national level mechanism. Now it's located in the Ministry of Emergency Management. So if the first level catastrophe occurred, so the FEM will be hold the whole of the operation process, and also if the public health issues occurred, for example, COVID-19. Now is the in China part is the Ministry of Public Health will operate in the level 1st emergency issues for public health, and here's the divisions of the main principles of different ministries, and also we will give the provide the guidance for the provincial level, so our local government level. So here is the level 2, level 3, and level 4. So from the provincial, regional, and county level. So as belong to the government, and also now MEM is focused on the emergency preparedness, capacity building of international heavy user. So, you know, in the first 2 years, we have established the new one international heavy user team, and also we focus on the capacity building of 7 kinds of international rescue teams, as include about the water or water search and rescue, and also mountain search and rescue, and also earthquake, and also aero, and also the chemical park exploration. So this and also the forest fire. So and here is the 7 kinds of international rescue team, and also 4 kinds of domestic rescue team, and also some important science and technology plan on emergency management, and also the assessment of disasters. So but the capacity building of national level user team is the main task for MEM. So the third part is about the future development of ARNAP and the plannings in the maybe in China and also in the developing country. And here we can see here this picture is showed the global seismic risk map. We can find from the China part, from along the Himalaya mountains and Tibet, we find a very high risk area, and also in the East area, Middle East area, and also to the European country, to the Alps mountain area, and to the France, to the west part of Europe country. And here is a high risk seismic area. And also we find along the North American, the west part of North America and the South America, there's a very high seismic risk area. But here we can find this, here's the legend. We can find the green colored as the heavy user team in the world, whole of the world, and the red colored one is a media user team, plus the international heavy user and media user team, plus the certification. So now we find most of the heavy user and media user teams located in the developed country, but along the many high risk area, this area and also here, there are no more heavy and media user teams. So if the bigger catastrophe occurred, we know if we hope to have an efficiency saving life, we must very quickly to mobilize the USAR team to arrive to the heavy damaged area. So if we want to save time, we must establish some heavy USAR teams very close to this very high seismic risk area. So that will be very useful for the capacity building along the belt and road countries and regions in this area, and also in the Asian countries. In Asian countries, there are no many heavy and medium USAR team. So we in one country, just like here, we show, for example, in China part, we have a national level, we have more than 30 provincial local government, and we have about 600, more than 600 regional level city and local government. We have 3,200 county levels. So, and if we are the bigger the disaster occurred, if we mobilize the local and the country level USAR teams very quickly to arrive there, we will save a lot of lives. So depends on the UN OCHA, depends on the USAR guideline. The accreditations of national USAR accreditation systems, if we are in the futures, we think it's very important to focus on this high seismic risk area countries to build more heavy USAR capacity buildings, heavy USAR team. And we let them to have a high level capacity, so that will be save more time, more lives. So, and ERNAP certification, we think we not only developed in China part, and also we think in the Asian country, in other area will be very useful. So from last year, we hold a national standard. We call it the guideline of capacity building and then classification certification of national urban search and rescue team of China. We just compile this national standard guideline. So maybe in the up to the next year, in the end of next year, we will declare this standard to domestic of China. So we think this this national or we call it based INSRAG recognition of NAP, national accreditation process, will not only very useful in China part, and also we think will be very useful for the countries and the regions along the road and the belt initiatives. So that's my talk about the capacity building of USAR teams. In China part, we give a pilot project research result, and then we hope through the team's platforms we can input Chinese experience of capacity building to the international and other countries' national levels, how to build the local heavy USAR teams. So that's my talk. Thanks a lot.
Thank you very much for that presentation. I mean, congratulations. That's a significant investment. I was working at one point in developing a heavy USAR team, and that is a tremendous investment and a huge project in terms of not only just resources, but training, equipping, personnel, and everything. So
Yes.
really tremendous investment and well done for China to be able to build that kind of capability. That's amazing. In the interest of time, if you do have any questions, please use the Q&A session, and Guosheng will stay with us and be able to answer those questions. But in the interest of time, let's go ahead and move to our next presentation. Okay, so next presentation. So Chaim, over to you, and I will go ahead and stop sharing.
Good morning, a pleasure being here. My name is Chaim Rafalowski. I'm the Disaster Management Coordinator of Magen David Adom in Israel, and I'll be speaking on behalf of Magen David Adom and the No Fear Project. This morning, thank you for the opportunity for being part of this very interesting and important conference. I will be talking about new opportunities for emergency medical services in times of pandemic. Magen David Adom is an interesting organization. We are basically three organizations in one. We are the National Society, which is part of the international movement of the Red Cross and the Red Crescent Societies. We are the National Blood Bank, and please bear with me as Israelis. We like a lot the word national, but please bear in mind that we are only 9.3 million inhabitants, which my colleagues from China would say, okay, you are a small town in our country, like some other major cities in the world. And we are also the public ambulance provider for the whole country. Israel has one ambulance provider. It's not part of the government, but it's Magen David Adom. As any other Red Cross society, we are auxiliary to our public authorities in times of emergency. And this is what called for the involvement of Magen David Adom during the pandemic in activities which are normally out of the scope for an ambulance service, or as we call it, an EMS, an emergency medical service in country. Magen David Adom is a rather small organization when it comes to paid staff. We are 3,500 paid staff with a very important core group of 25,000 volunteers. Many of them act as first responders. And this is really what gives us the strength and the capacity to expand our activities beyond our normal activities and support our authorities in doing more in times of emergencies. I will allude to that later. I just want to draw your attention to the image on the left-hand side, which is a crew in the city of Jerusalem, which is composed of Israel, who is an ultra-religious Jew, a volunteer, Haggai, who is the paramedic on the team, and he lives in a settlement in Judea and Samaria, and Fadi, that since then is a paramedic, and he is a Muslim Arab living in East Jerusalem. And being a grassroots organization, as we like to call ourselves in the Red Cross, gives us the power that we have representation for all the subgroups in our interesting society, to put it this way, with many different groups, with many different interests and points of view. And I will come back to it, because when it comes to, especially to the pandemic, we believe that one of our greatest challenges during the pandemic is about trust. And the only way to gain trust from the communities we serve is by having a good representation from those communities and understanding their specific needs. And this is one of the most important strengths of Magen David Adom in this situation. We received during 2020 more than 8 million calls to our 101. This is the emergency number of Magen David Adom in Israel, which is 3 times more than in regular times. And it produced more than 700 dispatches, almost 800,000 dispatches of ambulances, which is lower than our annual average. This is one of the consequences of the pandemic. Unfortunately, people are afraid to seek medical care, and this is one of the long-term, we call it the long COVID effect, that we will see in the years to come, that people that suffered medical emergencies and were not treated at all, or were not treated on time. What have we done during the pandemic? We kept on dealing with patients, but dealing with patients meant that we were also dealing with COVID patients. Of course, with all the needs of PPE, disinfection, and things like that, and not having the capacity in the hospitals sometimes to receive all the patients with long queues of ambulances in front of hospitals. I think that everyone saw that. We transferred people, especially people who are living in long-term care facilities, to dedicated COVID wards. And for that, we have this unique bus that allows us with 2 full advanced life support beds and 11 spaces for non-critical patients to transfer large numbers of patients from one facility to another, which is a big advantage in these operations. But this is, I would call it the normal EMS. Then comes our outreach to the public. So we had to deal with mental health, and we produced information on mental health and stress during COVID, using our volunteers in the communities to disseminate that and to diminish stigma and help people deal with I would call it the human consequences of the COVID pandemic. We have in Israel 18% of our total population are Muslims. So we had to create, first of all, material for them, but more important, we celebrated twice Ramadan during pandemic. And Ramadan is a challenge because people are fasting during the day. So we had to set up a system where they can be tested and receive their vaccines at midnight after the fast is over. And more important, education about how to avoid contamination during the large iftar meal, which is a family celebration at the end of the fasting. In the same way, we have our ultra-religious Jewish communities where, for many reasons, they don't have access to public cars. So we had to set up these containers in the middle of their neighborhoods to allow them to come by foot and get tested on site, not expecting them to arrive to a testing site. We were involved in vaccination, and during the second wave, when we started vaccinating, and we started vaccinating December 20th, 2020, we are now celebrating 1 year since that vaccination, and at that point, our most vulnerable population were the elderly and those who are resident in long-term care facilities. And it was clear that we need to vaccinate them fast, and we don't want to bring them from their the home where they are living to a vaccination center. So Magen David Adom received the task of going to those homes, to those centers, and vaccinating them in place. We managed to vaccinate all the elderly population within 3 weeks, and 3 weeks later, the whole population with the second dose. And by doing that, breaking that chain of events where being elderly, living in a long-term care facility is like a kind of a sentence that you are going to get COVID and you are going to be very seriously ill, something that we are very proud of. It's important to understand when we did it, we were in the midst of a wave, so our healthcare system did not have the manpower to do that, and they are also not used, they don't have the capacity really to go in a mobile way from one elderly home to the other. Being a mobile ambulance service, this is what we do, this is our daily job. So it was for us easy. We agreed with our authorities that we will train our emergency medical technicians and paramedics who normally don't vaccinate people to do that. And by this joint effort of the public health system, primary healthcare system, and Magen David Adom, we really managed to outreach to the most vulnerable and later to isolated communities and really allow them to get their vaccine. And here you can see the collection of convalescent plasma by our blood services. So here you can see the figures, the samples that we are still taking either at home for people who are too sick to get to a sampling center, in the long-term care facilities, and in our drive-through complexes. More than 5 million tests that have been taken and that's the data for mid-November. We are also doing rapid antigen testing. The plasma units that we collected, more than 1 million vaccines that we have administered, and starting this Sunday, we will start vaccinating at schools, children 5 to 11, sorry, and the patients that were transferred. And I would like to show you a short video that was produced to thank and show our gratitude to our staff and volunteers for the hard work they have been doing during this pandemic. So, No Fear. No Fear is a 5-year project funded by the European Commission research programs. And it basically brings together practitioners, suppliers, researchers, and policymakers in the area of acute care of patients, trying to overcome the fragmentation of our sector and bringing together an understanding of the needs and the gaps. And it is around 3 pillars: the acute care of patients, the operations, and the training. And this is our timeline. And on January 16, 2020, we were still with the idea that we can manage. And then we very fast realized that COVID is here. And we shifted our focus from security-related incidents to COVID, and started a very, very long series of workshops, online workshops and webinars, to try and learn very fast what are the lessons observed so far. It was a quick and dirty exercise. It was not a validated lessons learned exercise, but we realized that the pandemic is affecting different countries in different timelines, and we can actually use the network to learn one from the other, understand what others were doing, what worked for them, what didn't work for them, and what can we implement to be better prepared. I'm not going through this, the details of this slide. It's just to show you how many webinars and meetings we managed to have, despite having responders. And that's the important thing. You need to remember that those who attended those meetings were actual caregivers, health caregivers, both pre-hospital and hospital, that shared with practitioners, with researchers and the industry their lessons observed, their gaps. We discussed them. We managed to do a remarkable number of webinars in No Fear, which were extremely helpful to all of us to better understand what is ahead of us in a reality that, sorry for the term, we were all shooting in the darkness. It was a new situation. We knew very little, and we were trying to learn as much as we can. And we greatly appreciate and thank all those who took the time to share with us during the height of the pandemic, really bad time in their own countries and organizations. I know that for many of them, participating in those webinars where fewer hours of sleep in a very short sleep they had that day, and we greatly appreciate them for that. So what have we learned? First of all, that emergency medical services, being busy, still normally have a telescopic capacity. They can grow and they can do more than they would do normally in something which is not their normal area of activity, which is a public health emergency. EMS are normally involved in emergencies when you have trauma casualties. Here it was about patients, it was public health, and EMS have that capacity because wearing PPE is part of what they normally do. Transferring patient is what they normally do. Temporary treatment of patients in what we call the advanced medical post is something that we normally do. We have to adapt and adjust that to reality, and many EMS were involved in temporary hospitalization centers, in convention centers, gyms, hotels, etc. Where our true power is with our volunteers and staff, and we grew with the number of volunteers and staff. To be honest, now we have an issue with retention, but at the height of the pandemic, people were volunteering to help, and they are our true value, and we need to cherish that, and we need to think about them as our true power. Technology comes second. Trust is key. And whatever activity we are doing, it's about trust. And we need to create trust among our staff members, among our volunteers, among their families, and among our communities. I have to say that the first 3 months were extremely difficult because we were changing guidelines and protocols every second day. Disinfection of ambulances, 1 pair of gloves, 2 pairs of gloves, FFP2 mask, surgical mask, whatever. And we had to be very transparent and to communicate to our people, especially about things that we did not do and why we're doing it and why we are changing things. And the truth is because we were experimenting as we were running ahead. And people understood that as long as we were honest in our communication, and that had an important impact on them following distancing guidelines, protection guidelines, quarantine guidelines, and of course, when it came to vaccination, about getting the vaccine. Having our communities, for me, that's one of the most intriguing questions following the pandemic. What is a community? Because personally, I believe that virtual communities during this pandemic had way more power than physical communities. So I can look into our EMTs as a community because they have their virtual communities. But even then, the 20 years old EMTs are one community, and the older guys, myself, are another community, to be one of those who don't have Facebook. Risk communication. For all my life as a crisis manager, I'm trained in showing up to a press conference and how to deliver a message in front of a camera. And then suddenly we are playing a totally new ball game with social media. And we realized, and I think we realized too late, and we're not good enough in that. That while we're saying something in front of the media in a press conference, social media is already contradicting what we are saying. And in many cases, social media has more power than what we are saying in front of the media. I already spoke about transparency and real-time communications. Taking care of our team needs is essential. And sometimes it was about stupid things like when we had lockdowns, supermarkets would close early. So people would tell you, I have no problem working a double shift, but if I'm working a double shift, by the time I'm out of the shift, the supermarket will be closed. I will not have food at home. So we had to take care of that. We had to take care of people who are living alone at the town, they are renting, and they don't have the support mechanisms when they went into lockdown. People who are living with their elderly parents and were really afraid of bringing the disease home. And even small things, something that I really like, the London ambulance service, LAS, they were like, our people were working extremely hard. So our supervisors were going around from one hospital to another to give them a cup of tea. It's not about EMTs and paramedics in LAS that will not survive if they don't get their cup of tea. It's about showing that you care. It's about showing that as a manager, and we know that as managers, we in many cases are tough. We appreciate what they are doing, and we know that the cup of tea is not about the tea, it's about showing care. And the importance of real-time experience sharing. Through our webinars, we realized that we have something in the pandemic, which is called silent hypoxia. All my life as a paramedic, I've been taught that don't trust the devices, your pulse oximeter, your monitor, trust how the patient looks. And then suddenly we have patients that look fine, are extremely hypoxic, and will crash. So this is something we realized through the webinars, and there are countless patients in Israel that thank their lives to the idea that Magen David Adom was organizing and taking part as part of No Fear in those webinars, and we highlighted the importance of the saturation in those patients, and we were insisting on bringing them to the hospitals, so we will not have to pronounce them dead, but treat them as they crash. What are our challenges? I already spoke about the effective risk communication. People are tired. A colleague from another country used the term, we are burning them out. 2 years into the pandemic, we see people leaving acute healthcare, and it's in Spanish we say it's raining on wet grounds, because the acute care systems, both pre-hospital and hospital, were already short of personnel before the pandemic, and that's becoming a greater challenge, or worse and worse as the time goes by. We all moved to online training, which is great, but our business is not about knowledge, it's about skills. And I personally doubt our capacity to gain skills through an online training, or retain skills throughout online training. So we will have to better understand skills retention and create new models to do that. Better home care. People are not that enthusiastic to go to hospitals now. So we see more and more patients who don't get on time to medical care when they have an acute medical problem. We will have to rethink our telemedicine, our primary healthcare, and how we allow people really to get better care at home, but still receive the acute care when they need it. And of course, there will be some things about the pandemic that will stay even when COVID is gone one day, as we see it in some parts of Asia with face mask. And so we have to think what is there to stay. There are good things, the idea that we can do meetings online and we don't have to travel 1.5 hours in country to attend a 45 minutes meeting is a good thing. So we will have to see what's good and keep it, and what has to be changed. And I would like to share with you this gratitude of the city of Jerusalem that illuminated the walls of the old city, saying, "Jerusalem salutes Magen David Adom." I would like to thank the opportunity. Thank you for attending, and please get vaccinated. That's the only way out. Take good care of yourself, yours and your team. And I would like to finish with one important thing. We are all talking about a healthcare crisis, a public health emergency, which is true. What we forget to say is that healthcare providers cannot get us out of this situation without strong participation of communities. Only together, the public health sector, the healthcare providers, and the communities, together we can win this pandemic and go ahead. Thank you very much.
Thank you very much, and a very interesting presentation. And there's really some common themes here that we're seeing throughout this morning, which I think are quite important, which is the fact that we're seeing, some of these topics coming out in terms of communities, right, and building local resilience. And then really the points that you picked up on, I think, are becoming more and more a common theme, which is sort of in this transparency, trust, and other aspects in terms of governance and managing a crisis itself. And so I think that's incredibly interesting. And the burnout topic is actually something that is, I think, sort of a conversation that's happening globally. We've even seen in some international organizations looking into the issues of burnout with hospital care staff and healthcare industry staff because of the fact that it has been such a tremendous impact on the industry over the last 2 years that, you're starting to have these long-term effects now inside the system. So very well done, very good presentation. If you have any questions or anything else like that, feel free to go ahead and reach out directly. Otherwise, we're going just a few minutes long. We're going to go ahead and go for a break, and we will be back in 15 minutes. Okay, thanks everybody, and we'll be back shortly.